In my practice of nephrology, I've really focused on patients who have autoimmune kidney diseases. When I started out many years ago, my interest in training in undergraduate work was as an engineer. And I found the idea of nephrology fascinating, and I felt there was a need and we could apply engineering tools in the design of artificial kidneys. So that's how I got introduced to nephrology, even really before medical school. When I went to medical school, one of the classes that we have to take, and I don't say that in a bad way, but really opened my eyes, was immunology. And I instantly fell in love with that discipline. It was challenging, and of course, that many years ago, we certainly didn't have the tools we have now to analyze the immune system or manipulate it or treat diseases. So it was a real important area. And then I thought, well, how could I combine immunology and nephrology together, because I still had my interest in the kidney. As I matriculated through medical school and then residency, I realized that the study of glomerular diseases was really the interaction of these two areas of medicine. And so it afforded me the opportunity to do research in immunologic kidney disease, and that's what I spent my fellowship doing. When I transitioned from fellowship and I was recruited to Ohio State 26 years ago now, I was attracted to this institution more than other places that I was looking at the time, because there was a large focus on immunologic diseases of the kidney, and that was through our previous division director, Dr. Lee Hebert, who's an expert in the complement system, which is one of the innate mechanisms of host defense. I was recruited here, I came here, and over the ensuing years, I spent a considerable amount of time in a basic laboratory studying mechanisms of inflammation in the kidney. And of course, I was using animal models of kidney disease at the time. As I got older, or as I'd like to say, more mature in my thinking, I transitioned my laboratory into a more translational focus and started working with patients and patient samples to see if we could take some of the information we were learning at the bench and relate that to patient care. And that's essentially how my career has developed at Ohio State. And now I see almost exclusively patients with autoimmune kidney diseases, and by that I mean patients with systemic lupus erythematosus who have lupus nephritis, patients with systemic vasculitis who have involvement of the kidney, and then patients with primary glomerular diseases. The glomerulus is the filtering unit of the kidney, and it's often attacked by the immune system. And there's a whole variety of these diseases. And we have, with this sort of idea, developed a very comprehensive program, one of the few comprehensive glomerular disease programs in the nation, and are now starting to reap the benefits of that, seeing patient referrals from outside Ohio, even some international referrals.